Catherine Kasavuli's death shook the nation. She was a role model to all journalists and was taken too soon by cervical cancer. It is Cervical Cancer Awareness Month, and it is critical for women to normalize cervical cancer screening as part of their annual routine so that HPV or cervical cancer can be detected and treated early. I am Halima Sabwa, and welcome to the AMREF podcast, Creating Lasting Health Change in Africa. Sitting with me in studio today is Dr. Baraza. Please introduce yourself and tell us what work you've done with AMREF.
So my name is Dr. Chris Baraza. I'm a obstetrician gynecologist. You guys usually call us gyners.
Yeah.
So I'm a gyner by training, and also have quite a number of years working as a health system strengthening partner. So by and large, the topic we are going to discuss today is basically looking at cervical cancer screening, but within a context of a health system.
Okay.
Because that's what actually as AMREF we are working towards.
So what is a cervix?
Oh, wow.
We have to start somewhere.
The cervix is a part of what we call the female reproductive system. In medicine, when you say cervix, it means the neck more often than not. So it's the neck that joins the lower part of the reproductive system, the upper part of the reproductive system, which is the uterus, for that matter. Right. So there's a communication between the lower part, which is the vagina, the upper part, which is the uterus. In between, there's what we call the cervix.
If you do get cervical cancer, what would some of the early symptoms of cervical cancer be?
Yeah, so if you get cervical cancer, and let me just go back and mention that cervical cancer is an unfortunate end to a very long process that usually starts maybe 15 or 20 years earlier.
With human papillomavirus, HPV,
papillomavirus.
Yes.
So the cervix gets actually, once you get an infection by human papillomavirus, and this happens upon a lady getting into sexual activity. So once they get into sexual activity, there's a human papillomavirus infection, and then there are certain changes that happen in the process that progressively leads into the development of cervical cancer for that matter, after a long period of time. And that's why I'm saying it's usually very painful to us as gynecologists or medics if someone comes and they actually end up dying in cervical cancer.
Yeah.
Because it's a purely preventable cancer. It's one of the very few cancers that are actually preventable in nature. So it's a painful process. And we are hoping that by creating this awareness, we shall actually have more and more women coming early for screening and diagnosis of cervical cancer.
Let's go back to HPV and human papillomavirus. So I don't think it would be general knowledge, but let's say that before you get cervical cancer, you get HPV, right? And most of the population, women especially, don't know that they have HPV. So at what age, to prevent cervical cancer, what age would you recommend that young women or girls get the HPV vaccine?
Thanks so much for that, Halima. The average sexual debut, that's the period when girls start having sex in this country now, has been consistently going down. Now we're talking about 15 years.
Even 13, actually.
13.
Yeah.
The average is about 15.
15, yeah.
But there are those who are as young as 13, even 11, getting into sexual activity for that matter. And so the moment you get into sexual activity, you get the HPV infection. Because almost all of us, both females and males, actually have one form or the other of HPV.
When you're talking about the virus, a lot of women do fight it off. So there has been talk that a lot of women do have HPV, but the body takes care of it, and so it doesn't become cancer and metastasize into cancerous tumors. So if you're talking about women getting the HPV vaccine, so you said it should be 13, should men also get the HPV vaccine?
Resources allowing, then both men, or the boy child and the girl child, should actually get vaccinated. But now in public health approaches, we usually look at where can we get the maximal benefit by a particular intervention.
That's true.
And that's why we say yes, like in a resource poor setup like Kenya here, we actually say let the girl child be vaccinated because the ones that are more likely to progress into cancer of the cervix.
Yeah.
And I'll come to that later, but the question will be, why do some progress to cancer of the cervix and others don't,
Yeah.
for that matter? So, by and large, ideally, both the male and the female should be vaccinated, but because of limited resources, we shall now make a preference to have the girls vaccinated as early as around 12 years, 13 years.
So, as a preventative measure, how effective are pap smears in, finding HPV and preventing cervical cancer?
So pap smear is just one way of screening for cervical cancer. There are different ways of screening cancer of the cervix. We have what you call HPV screening. So we have kits out there.
Okay. How much are those kits, would you know?
Depends on whether it's private, public. Sometimes it goes up to 5,000. Sometimes can even go to around 3,000, depending actually on where it is. There are some pilots, there are some programs I know that are piloted actually to give free to some government facilities at some point. I'm not so sure that those programs are still running. But the point is that these kits were meant to actually have self-administration. So it's self-testing.
Yeah.
So you have this the HPV screening kit. We demonstrate to you how to use it. Either we can do the sample collection in the hospital or at facility as you want, or you can allow it to go home, depending on your level of understanding. Yeah. Do the test, and then you bring back the results for discussion. That's HPV. So HPV screening can be done, and it can either be provider initiated, that means as a healthcare worker, I do it for you, or you can do it self-testing for that matter.
Okay.
The second test that we usually use in our setup is what we call visual inspection using acetic acid, VIA. Okay. So in this case, usually a patient has to, or a lady has to come to the hospital. We do a speculum exam, then we check on the cervix, okay? Then we apply vinegar or glucose iodine, and then we give it some bit of time, about 3 minutes usually, 3 to 5 minutes. Then we check again. So there are changes that may happen on that cervix, which us as clinicians can be able to interpret and tell you, yeah, this is early disease, or this is just progression, or we advise you on the next steps that we need to undertake based on that. Okay. It's a relatively cheaper option that you have. Yeah, I don't think it will be more than 1,000 to do this, because vinegar is very cheap and glucose iodine is very cheap for that matter. But usually the drawback with that usually is two things. One is, of course, females or women saying, how can I go to the clinic without being sick? And then secondly is it's a bit subjective. We need to have a bit of technical know-how for you to interpret the results for that matter. The third test that we usually use locally here in Kenya is the pap smear. So the pap smear is, as you mentioned, is a conventional way of, again, doing it. Most of the countries have used it. And then you'll be able to now, of course, go have a speculum exam. We do what you call the cytobrush. We take the samples from the cervix, then we do a smear. The difference between pap smear and VIA is that for pap smear you need a pathologist, someone from the lab, to interpret the results for you.
Okay.
Yeah, so they'll tell you, these are the changes that have happened on the cervix, so we need to do 1, 2, 3. It takes a bit of time, of course. It's a bit more expensive because you have more people now being involved. This time is taking the sample, this one is reading the results, and then they get back the results, and then you can be able to move on for that matter. Of course, the screening is aimed at actually early identification and then early treatment. Because as I mentioned, I want to emphasize that it's a whole period of time for progression of the disease. So we emphasize on screening using any of those methods because they are comparable, depending on the costs and how affordable they are and where you are. But the bottom line is, the recommendations usually are that from the age of 21, you need to undergo screening because you are sexually active. Okay. And I trust you, every time I get out of 10 women, I'll ask that question, and maybe 2 of them have been screened. So screening, depending on the results of the screening, we will guide you, and depending on whether you are HIV infected or not, or how your immune system is,
Yeah.
we shall guide you on whether we shall screen you every year, or every 3 years, or every
Okay.
5 years. Again, depending on your age, whether you're HIV or not, your nutritional status,
Yeah.
and your other vulnerabilities that you may have. Because the more vulnerable you are, the more frequent you have to screen. Most public hospitals actually, they have the treatment approaches.
Okay.
I walked in there. There's what you call cryotherapy. So you go there, then they just freeze the cervix. Huh?
Actually, people talk about that and they say mikuchoma. So they freeze the cervix.
Kuchoma cervix.
Yeah.
There are two different ways of kuchoma that people talk about.
Okay.
So there's the cryotherapy. I use either nitrogen or carbon dioxide. Yes, and then the equipment that actually have been bought. The government actually bought most equipment for most county and sub-county hospitals in this country. There's a project that was there about a while ago. So you'll be able to go by what kuchoma, so we treat you, then you go back home, then we advise you on the next steps.
Okay.
Or, depending on, again, where you are, and to what extent it is, you can actually decide to do a surgery.
Yeah.
And say, yeah, it's still early, but you are 45, you've finished your reproductive career, they usually call it, because you have finished giving birth to your children. Then there's no point of you having a cervix and the uterus.
So now what I would like to ask is, what health systems can be strengthened to reduce the prevalence of cervical cancer?
So how do we give equitable health services to this particular lady who is very young and this other lady who is very sick? So the principles of equitable service provision is very critical to us. We are looking at access to services. How does this lady who doesn't have cancer of the cervix access screening services to prevent cancer of the cervix? At the same time, allow this lady who has cancer of the cervix to have access to appropriate radiotherapy and surgery for that matter. We're talking about client-centered care. How do we customize your services such that we will give you what you actually want, deserve to have in a way that is very holistic? So you're going to take care of your mental health aspects, you're going to take care of the insurance aspects, you need to pay for the services, you're going to take care of other aspects that are patient-centered, because most of the times actually we generalize in our approach, and quite a number of women have come to me with cancer of the cervix at the end of the day. Then you look back, then you realize there are quite a number of gaps as she was trying to navigate through the health system. In service provision, in primary health care provision, you have what you call the social determinants of health. How does your level of education influence your utilization of cervical cancer services? Does it mean that if you are a Form 4, for example, you will utilize the services better than someone who never went to school? The facts are there. It's a fact. The more literate you are, the more likely you are to use health services to cancer the cervix screening treatment. Basic things like health education are very critical. They'll come back to that again in a short while. Infrastructure. How does the availability of a road? You go to Turkana, where I work most of the time, and you find that distance between one health facility or the community health facility is around 50 kilometers. And there's no road to actually take you there. So do you want to tell me that this lady will just wake up one day and say, my cervix is very important, let me go and get screened. Let me walk for 50 kilometers for me to get screened because I would like to get cervical cancer. It will not happen. Because the other thing that is critical is the climate change. And I'll give you still another example of Turkana County. There's a lady who is asking herself, where will I get the next meal? Here you are telling a mom, just leave what you're doing, walk for 10 kilometers, go get screened, and then you come back home. You will not find food at home, and it will be a problem by your same-sex husband, for that matter. And that brings the issue of stigma. Okay? All those are what you call social determinants of health. So what really are some of these factors that we are looking at that influence health outcomes, which are very critical in terms of developing what we call partnerships. So how do we partner with the Ministry of Education, even as we are rolling out HPV vaccinations among adolescent girls in schools? How does AMREF Health Africa partner with schools for them to have an effective HPV rollout program? How does AMREF Health Africa partner with the county government of Turkana? The national level, the counties working in the ASAL counties for that matter, areas in the arid regions for that matter. How does AMREF partner with them? They could deliver more comprehensive primary health care model for that matter. So the moment we forget about that or we overlook some of those critical components, then it becomes very difficult for us to deliver on the mandate. And there's something I like talking about that has worked in most other countries, what we call the triangle that moves mountains in healthcare. And those things you've been talking about are critical there. The first one is basically at the tip of the triangle. If I was to draw it like this, is what we call the government. So what's the government's role in ensuring that the different roles the government plays in healthcare? They are what we call stewardship, policy and guidelines. We have finance. So how does it ensure that that lady in Turkana who needs to be screened for cervical cancer has access to services? Through insurance, for instance, and HIV. Can a policy be put in place that allows people to be screened when they have an HIV?
That's true.
How does that mama who is in Kwale access healthcare? Through a government policy that helps them to achieve that. So government is very central in whatever they're supposed to do in terms of ensuring that we have increased access to services. The second component of this triangle basically is the technical capacity for us to deliver on the service. You can have very nice policies, but if the county government, the private sector, if the hospitals don't have infrastructure, they don't have the technical know-how to deliver on this. You don't have a pathologist in the whole of, let's say, one region. You don't have a pathologist in the whole of that county, for example. Then forget about pap smears.
That's true.
Because the samples will be taken, and then now the pap smears have to be shifted to another place, let's say Eldoret or wherever they are. It takes 2-3 weeks to read by the time the results come back. Sometimes you find that by the time the results come back, it has progressed to that matter. So how does county governments partnering with the AMREF ensure that there's technical capacity to deliver on the screening treatment of cervical cancer? It's critical. What is about the referral system? Okay. How is the referral mechanism working? All the way from the household where this mother stays, okay, to the highest level of referral. If a mother's night right now starts bleeding, and we take her for screening and we realize that she has cancer of the cervix, what referral mechanism do we have that we can actually enable her to go through the health system? The last component of it is what we call community engagement and education, advocacy. That's what you're doing here. Going out of our way to go to the communities, to talk to those chiefs, opinion leaders, households, the men in the community. Very important. Because
I think it's the most critical aspect actually.
It's a patriarchal society we live in, unfortunately. They make decisions. So when they tell you they don't have money to go to hospital, you don't have money. So you have to involve them. And in any case, we are the ones who carry the HPV virus. We transmit it, cross-transmit it too. So you have to be involved, we have to be engaged in decision making. You have to understand why you are doing pap smear, why we are actually supposed to pay for it, for an example, and why you should be able to actually facilitate these ladies to go to a hospital, as and whenever it's required.
That's very true. Thank you so much for tuning into the first AMREF podcast episode. This has been your host Halima, and thank you so much Dr. Baraza for being in studio with us for the very first podcast. If you have any questions, concerns or queries of cervical cancer, our social media handles are Twitter at @AMREF_Kenya, Facebook at AMREFKE, Instagram is #AMREFKenya. We would love to hear your feedback, and thank you so much. Goodbye for now.